Rubin, and today we're joined by two individuals from the Portland Clinic and Kaiser Permanente, and we're going to be talking about the power of collaboration, how these two organizations are coming together to benefit you, the patient. Our guests today are Dr. Micah Thorpe from Kaiser Permanente and Dr. Craig Wright from the Portland Clinic, the new Chief Medical Officer. So gentlemen, welcome to our chat today.
Thanks.
If you have a question to ask during our conversation, please leave a comment below in the Facebook page. If you're on Twitter, you can use the hashtag AskPortlandClinic, and we'll try to get to as many questions as we can. So let's get started. We're here today to talk about the two organizations, the Kaiser Permanente and the Portland Clinic, and how you've come together. So Dr. Thorpe, can you give us a little bit of background of how this came to be?
Yeah, so this started a few years ago when Kaiser has a series of insurance products that allow members to go to outside groups and see outside providers. There was a thought that it would be great if we could find a group that was similar to ours, that looked for high quality, affordable care, and had many of the same values that we do, that we could refer patients to and that we could direct them to with these insurance products. It worked so well initially that we gradually began to expand it to Medicare patients and then finally to all Kaiser members.
Oh, great. So, Dr. Wright, what is the mission of this collaboration between the two organizations? How do you view it?
Yeah, I think the mission is related to providing great care in the community. So both Kaiser and the Portland Clinic have been in the community for a very long time. And taking care of patients in the community and have like-minded about cost and quality outcomes, provide great care. And I think part of our collaboration is to provide increased access for those patients who have Kaiser insurance. And we're thrilled, the Portland Clinic, to be working with Kaiser Permanente over the last several years.
Oh, great. Dr. Thorpe, what's your view of the mission, how you see it?
Yeah, so first off, just conceptually, the idea is for Kaiser members. Kaiser's the idea is we have our own delivery system and we try to utilize that as much as possible. With the Portland Clinic, conceptually for members, it means that the Portland Clinic is in effect a part of that system. Any Kaiser member can go see a Portland Clinic primary care physician or receive any services that the Portland Clinic offers within the Portland Clinic. If they don't have it, then they come back into the Kaiser delivery system. So that's kind of how it works. The idea, just as Dr. Wright said, is to provide increased access. The Portland Clinic locations, many of them are in places where there's not a Kaiser facility, so just geographically it works out very nicely. And to improve the overall care of the community and the care of our patients.
Right. So both organizations have been in the Northwest and in the Portland area for quite some time. I know the Portland Clinic's coming up on 100 years.
Yes.
I think Kaiser's been here over 70 years. So obviously both healthcare facilities have been in the fabric of the community for quite some time. Mm-hmm. How do you see this being unique? Is it a unique relationship nationwide for Kaiser?
Yeah, so for Kaiser, this is really quite unique. We've never had a partnership quite like this, where we've actually had an outside medical group who we essentially are bringing in and making part of our internal network. We've made a lot of strides over the last few years in trying to integrate the two systems as much as possible, so that patients have a similar experience in whether they're seeing someone in the Portland Clinic or someone at Kaiser Permanente.
Dr. Wright, is it pretty unique for Portland Clinic as well to have this type of relationship?
Yeah, we work with a lot of payers in the community, but the Kaiser relationship is a bit unique. I think one of the main messages is there's no real difference from a Kaiser patient perspective between a Portland Clinic doctor and a Kaiser Permanente doctor. And so we have clinics. We're about 100 providers in the community. We're located in Beaverton as well as downtown and Tigard in our new facility out east side at 50th and Sandy. And about half of our 100 providers are primary care. The other half are specialists that are commonly referred to out of primary care. And so patients can move through our system, both the primary care, specialty care, as well as other needs like diagnostic imaging or ambulatory surgeries, all contained within the Portland Clinic. And and they get great care inside our system. And as Dr. Thorpe also said, is that if there's things like neurosurgery or maybe pediatric subspecialty or oncology, some things that the Portland Clinic doesn't have, which are few and far between, they're able to use the great doctors at Kaiser Permanente.
Okay. So it sounds like this is a really big benefit for patients here in the Portland area who utilize Kaiser and then have the option to go and visit the Portland Clinic when it's convenient for them. Tell me a little bit about how that benefits the patients long-term and also short-term.
Well, so I'll give you an example. So I have a few patients. I'm a kidney specialist, and I have a few patients who are managed. Their primary care doctor's a Portland Clinic physician. Portland Clinic doesn't have dialysis done within its system, so those patients were referred to me, as they got close to needing dialysis. And we've been able to manage those folks. The primary care physician is near where they live. We don't necessarily have a facility that's near these folks, but we're able to help their primary care physician manage their dialysis and their end-stage renal disease. So it's convenient for the patient. We have a fairly seamless interaction with our colleagues at the Portland Clinic, and are able to manage that to the best benefit of the patient.
Oh, great. Is this a referral type of situation when a patient needs to go to one of the other organizations, Dr. Wright?
Yeah, there is no referrals for primary care inside the Portland Clinic for those patients who have Kaiser insurance. Once again, the Portland Clinic primary care doc is just like a Kaiser Permanente primary care doc. We do use referrals for coordination of care to specialties. And so that that is done as part of our system of care and helps coordinate this care back and forth between primary care and specialists. We're all in the same electronic health record, and so we have seamless information passes between primary care and specialty, as well as our other centers of care like the surgery center or the imaging center. So it's all coordinated, but referrals do help coordinate the care between primary care and specialists.
Okay. Great. And tell me a little bit about the lab and imaging since you brought it up. Is that also a similar type of referral situation?
Yeah, it's a similar situation. Again, if it's done inside the Portland Clinic, it can be done there, and if not, then it's referred back into the Kaiser system.
Okay. Great. Well, if you're just joining us, we're here talking about the power of collaboration, Portland Clinic and Kaiser Permanente, and how the two organizations work together. And we're joined by Dr. Craig Wright from the Portland Clinic and Dr. Micah Thorpe from Kaiser Permanente. So, Craig, you mentioned the locations as well. Do you have some specific instances of how this really has benefited the patients and allowed them to have less time in transit between care?
Yeah, sure. Well, I think once again, it gives Kaiser Permanente patients options to be in the Portland Clinic system. And we had a patient just this week who ended up needing orthopedic surgery, but she had a primary care doctor in the Portland Clinic, was seen by the specialist, had an MRI done in our imaging center, the whole part of the Portland Clinic, ended up having a shoulder surgery in our ambulatory center, and then was returned back to the primary care clinic, all within our system of care. And so, once again, the majority of the care that happens in the community can all happen within our system, and it's all coordinated, and we feel like we have great outcomes in everything we do.
Oh, great. Dr. Thorpe, I'm sure you have a ton of stories, but from your perspective, how is this relationship working from the patient's point of view?
From the patient's point of view, again, the goal was to make this relatively seamless. So again, I was thinking of one particular patient who, lives in kind of the Tualatin area, goes to the Portland Clinic primary care facility there, comes to see me as needed for his kidney disease, gets all of his medications through the Kaiser pharmacy. We have a pretty extensive mail order pharmacy, some of which are ordered by me, some of which are ordered by his primary care physician. It's really quite a seamless system between the two. There's not a lot of faxing and paper and that sort of thing that flows back and forth. It to the patient looks like it's one entity.
Okay. So you mentioned pharmacy, Dr. Wright. How does this work? A lot of people have prescriptions, and it's every week. how does the pharmacy situation work out?
Yeah. Well, as Dr. Thorpe says, I think it is very seamless. We use the Kaiser pharmacy system, and so either primary care or specialty care providers will write a prescription, work through the Kaiser system, and get their medications, usually mail ordered for those that are on chronic medications.
Okay.
The information just flows seamlessly.
So let's talk about the nuts and bolts of scheduling an appointment and how does this get through it in the system? How does it all start?
Kaiser patients, call up membership services, or they call to schedule an appointment. If they're if they want to go see a Portland Clinic provider, then they're directed by the scheduling person, the membership services, into the queue at the Portland Clinic, and it's basically handed off at that point. And scheduling is done for the Portland Clinic and the Portland Clinic system.
Okay.
Yeah, I think that patients can pick their primary care provider. We feel like that model works well to have a primary care provider, and they can pick a Portland Clinic primary care provider or a Kaiser Permanente doc. It's the same thing either way.
So Portland Clinic considered in-network from a Kaiser perspective, and are there additional co-pays or anything that would be outside the ordinary?
Yeah, it's essentially the same. And I should add, with scheduling too, it works seamlessly the other direction. Kaiser members who are seeing the primary care physician at Portland Clinic, who the referral is made into the Kaiser system, get the same phone call to have an appointment scheduled within the Kaiser system. So, so the appointing is done within both systems, and it's fairly seamless.
Okay. I know a question has come in about cost. Is this a cost savings for organizations and also for the patient? Dr. Wright?
Yeah, for the patients, they have the same cost to access the Portland Clinic system of care or the Kaiser Permanente system of care. So there's no difference in what the patients pay in either system.
And I should add that for organizations, for employers and folks who are purchasing insurance products, part of the attraction of this relationship, again, is that shared value about, values that both organizations have about, value-based healthcare, and making sure that that affordability is a part of the package, that it comes with quality and with service. And so for employer groups as well, this has been a very, very good collaboration.
So let's put our crystal ball hats on for a moment. And where is this relationship headed? And do you see improvements coming down the road in the next months and years, and this organization growing with this organization?
Yeah, that's a great question. Well, I think the model that Kaiser and the Portland Clinic have is a good model for how to serve the community from both cost, affordability, as well as quality outcomes. And I think there's lots of opportunities to grow the membership of Kaiser with Portland Clinic as part of an option, in addition to the Kaiser Permanente network. And so I think there's lots of opportunities for growth over the next few years.
Great. Dr. Thorpe, what's your view?
Yeah, I mean, we're constantly looking for, this has been such a good collaboration that we're constantly looking for places where we can do more stuff together. So my expectation is that 5 years from now, you're going to see even more kind of jointly done projects or services that the two our two organizations have put together.
Great.
I think the other thing I just add to that is that Mike has said this also, is that the culture is very similar. The thinking about how to provide care, how to collaborate and coordinate care between primary care, specialty, and the other services is very similar between Kaiser and Portland Clinic.
Yeah.
And so that culture, underlying philosophy, is really powerful to help us grow.
The organizations have been part of Portland so long. Was there collaboration going on even before this formal relationship? Because the doctors collaborate all the time, right?
Yeah, so we were actually joking beforehand. I as a resident, I actually remember admitting patients from the Portland Clinic from some of the physicians there. So it's the medical community here is relatively small, and the Portland Clinic's reputation was, I think, very clear to everyone in town. We a lot of people knew each other ahead of time.
Right.
So.
Well, good. Well, we've come to our last question. So how does the process start again for a patient if they want more information on how this relationship works? Where do they start on the Kaiser side?
So Kaiser side, everything goes through our initially through our membership services. Call the number on the back of your card, or actually you can call the Portland Clinic and ask. So you call either organization, and they will direct you to the appropriate place to make an appointment.
Great. Well, that's all the time we have today. So thank you for joining us on the Ask Portland Clinic chat. If you do have any questions you'd like to submit, you can do that in the comment section below, or hashtag Ask Portland Clinic on Twitter. If you have additional questions on how to make an appointment, call the Portland Clinic or call Kaiser Permanente, and they'll be sure to help you out. Thanks again for joining us. We'll see you next time.